I can start.
Okay, thank you very much. This is quite a surreal event. I think this is my first conference that I've chaired completely on Microsoft Teams. I've been using Microsoft Teams every day since the beginning of COVID, but it's the first time I've done a conference. So please bear with me and I will steer us through really well. So hello and good morning. According to my attendees list, we have 62 people on the call, which is fantastic. So thank you very much for joining us this morning. My name is Michelle Johnson. I'm the executive sponsor for the IV project, part of CapitalNurse's programme of work, and I'm really pleased to be here today. This most amazing piece of work that's happened. I'm also, my day job, I'm the Chief Nurse and Director of Allied Health Professionals at Whittington Health NHS Trust. So welcome to today. The way today will work is you can see the agenda in front of you, and I have a copy of myself, we have a list of fantastic speakers for you this morning, which will go till about 1 o'clock. We're going to continue through the speakers without questions between, and then have a live Q&A session at the end of the event. And for you to contribute to the Q&A event, if you could please go to your live event Q&A, which is up in the right-hand box or the bottom of your screen, depending on where it is on your device. And then you just type a question in, and I will then move it into a published question so everyone can see it, and then we'll take Q&A at the end. I hope that will work really well for us. I'm sure it will. We've had a practice run, so we're pretty slick at this. She says, hopefully. The team are all brilliant, so we will get underway very, very soon. Just a couple of housekeeping bits. If you could please keep your devices on mute, that would be really helpful. We seem to have a really good signal, so I'm hoping that you'll be able to hear everyone. The questions we've talked about, just the final point is the webinar is being recorded, and that's so that we can obviously learn from the questions that were asked and the answers given, but also that we can share it wider for people who are unable to join this morning. So before I hand over to Chris, I just want to really reiterate how fantastic this piece of work is. It was work that started long before COVID, but it's one of the positive outcomes of the COVID pandemic is that the work carried on to make this the IV passport live, and it was certainly beneficial to many trusts during the COVID peak of the pandemic and continuing as we go forward through recovery and into wave 2. I think we should thank lots of people around this, many of whom are presenting this morning, and there are many others that we need to say a huge thank you to. So without further ado, I'd like to welcome and introduce Chris Caldwell, who's the Director of Nursing for Health Education England COVID Response, and also the Programme Director for Capital Nurse. So I'll hand over to Chris now. Thank you.
Thanks, Michelle. Just checking that you can hear me. Michelle, can you stick your thumb up if you can hear me?
Yep, I can hear you.
Okay, brilliant. Okay, so thanks very much for the introduction, Michelle. As some of you will know, that I stepped out mostly out of my day job at the Tavistock and Portman during the COVID pandemic to work with Health Education England on their workforce response. And I want to start by echoing those thanks, and thank you to every single one of you who are on this call today, and all of the colleagues that are standing beside you and behind you who've made it possible for this achievement. And I don't think you should underestimate what a big achievement this is. When we launched the chemotherapy passport in back this time of year, actually it was September 2017, we were challenged by Eamon Sullivan, the Director of Nursing at the Royal Marsden, and he said, look, if you can do this for chemotherapy, you know, it's taken 10 years for us to get to this point with chemotherapy, but if you can do it for chemotherapy, we can do it for the general IV skills training. And I kind of laughed it off at the time, and as too big a challenge, but you guys wanted to do it, and it kept coming back. And so we were really anxious about it, because trying to get every single NHS organisation on board with the same approach to training is a massive cultural change. Lots of people were very invested in their training programmes and had done a huge amount of work over many years. So, you know, the kind of cultural change aspect of it is just phenomenal. So a massive thank you to everybody for that achievement. And the passport is a really, really brilliant example of what Capital Nurse is all about. People ask us all the time, so what is this Capital Nurse thing? And I say it's a model of change. It's about large scale change, and it's about winning hearts and minds and using collective action and collaboration to bring about change, using the people that are going to be involved in the product. It's also about improving the experience of nurses, and so that it makes it easier and better and more straightforward to work as a nurse in London. And it's also ultimately about the quality of care for Londoners, because if we're all trained to the same high quality standard, then wherever our patients experience us, they're going to get the same quality of care. So standardising training, reducing unnecessary variation in both the content and the process of that training, and making it possible to take that training from one organisation to another, because we know that unlike other parts of the country, London nurses move around. That's part of the attraction of coming to London. So it's really important that we make it as easy as possible to move around, and we don't have people spending training time and money on the same thing over and over again. So we're delighted that every single NHS trust in London engaged in this programme, and a whole range of primary care organisations, social care, and some independent sector organisations. And again, that's what makes London London. We have so many different organisations, and great to see so many people engaging. And also the fact that we were able to speed up the process to be able to launch the passport as we saw the pandemic coming, and the fact that we were able to use it to prepare student nurses to work in paid placements, and to move people around into new environments, and to put people back into practice who hadn't been in practice for some time. So again, as Michelle says, a real achievement for you know, and for a very, very important reason. I want to end really by thanking particularly Susie for leading this piece of work through a really, really challenging time. With the support of Michelle as the Director of Nursing sponsor for the programme, and also the rest of the team around them, Jacqueline and others who have been there to help steer the ship, and to all of you who have played your part in writing different parts of the work, in testing. And today we're going to hear about how the passport has been tested to be used with qualifying students, with new registrants, and with also to prepare students whilst they're still in their training. So I'll end by expressing those thanks again. I really, really do appreciate the huge amount of effort that everybody's gone to. Now we've got to roll this out and make it stick, and that's easier said than done, I know, but I know that you're all very committed to do that. We were really delighted last week to hear from some colleagues in Norfolk who've implemented the passport, and we want it to be the approach to training nurses across the whole country. So we need to really push for that in London through the way we promote this work. So I'm going to hand over to Susie now. Really enjoy this morning and revel in the fact that we've achieved this now, and I look forward to hearing about how that's happened. Thanks very much.
Chris, as we have 3 minutes, there is one question which I wonder if you can answer, because I know you've got to leave before the end.
Yes, sure.
This is from Sharon from FHFT, which I'm not quite sure which organisation that is. Is there a plan to roll this out nationally? And I know you've mentioned Norfolk, but
yeah, so the best way to push for us to be able to roll this out nationally is for organisations across the country to say they want to do it. With the chemotherapy training passport, it was a bit more easy because we did it jointly with the UK cancer nursing group. But if we can roll it out across England, then we will be able to get the passport, the skill using ESR's training database. So we really want to do that. So we will be. We know that the national team in HE know all about this work, and we've got the material. We're working closely with eLearning for Health, so it's on a national platform. So we will be pushing for that, and we will be sharing this with our colleagues regionally. So if you go and if you have colleagues across the country who want to roll it out, then let us know, and we'll lobby as much as we can. Any other questions whilst I'm here? I'm going to be around for about 45 minutes, but I won't be here for the Q&A later.
No, there's no other questions. Thank you very much, Chris. I think we're going to pass over to Susie Scott now to take us to the next presentation. Just before we do that, I just wondered, we've got a bit of an administrative problem, is the number of people who are unable to get in and intermittent. I think it might be their end. I'm sure Victoria and Zuli will pick that up, but just so that people are aware, there are a few people who can't hear. We now have 100 people joining the call, which is fantastic. So thank you. I'd like to just welcome Susie Scott now, who's the IV project lead for Capital Nurse and Senior Nurse Apprentice for Education at University College Hospitals London. Susie, over to you.
Thank you. Hopefully everybody can hear me. Thank you, Chris, and thank you, Michelle, for opening the webinar. It's been a really great privilege to lead this project, and I'm really happy to be here today to share the story of the IV passport. So 2 years ago, the project began, and at that time, as we know, nurses in London had to retrain every time they moved organisation. So this was frustrating for them, quite disempowering for us as a profession. Not great for health providers, costly in terms of time and resources, and for patients it delayed patients receiving treatment and put undue pressure on the workforce around them. So as Chris mentioned, London's nurse and midwifery leaders wanted to solve this problem and took it to Capital Nurse. And Capital Nurse, as a great and powerful change organisation, took this work on under the leadership of Chris, as you know, and also Selina Truman. So I was lucky enough to be asked by Natalie Holbury, who was the clinical lead at the time, to lead the project. And since then, so Jacqueline Robertson-Zaris took over the work and has been a great support since then. And also Michelle, as you know, has been the executive sponsor all the way through and has chaired our steering group brilliantly and provided that governance that we have needed. One other person I'd really like to say thank you to at the beginning is Chris Hill, who led the project for me for a couple of months when I needed to take a break, and also was really instrumental in the build of the e-learning, using his expertise there. And beyond that has been a great support to me with his pragmatic approach. Unfortunately, he can't be here today, which is a real shame for him, but hopefully he will watch it. So IV therapy. I've always felt really passionate that we get IV therapy right for patients. It's a high-risk intervention, it's complex, and proficiency is really crucial. So, and I've spent lots of time in my career helping nurses to gain IV proficiency. So for me, this was a great opportunity and hugely exciting to think that we could change this. But as we have mentioned already, and we will continually mention, it has not been possible without the engagement and commitment of stakeholders across London. And I could never have anticipated the response to the work. So thank you. And today's webinar is obviously about celebrating, sharing the work, but it's also about celebrating that achievement and the collaborative achievement for our professions. Next slide, please. So we had an old way and we now have a new way. Next slide, please, Zuli. So what we've achieved for nurses and midwives in our profession is amazing. And we now have one common approach for all health providers and for health education providers, higher education providers. And we know this approach as the IV Therapy Passport. So it has been truly designed and built by stakeholders, by subject matter experts, and really importantly, endorsed by the Royal College of Nursing, which we all feel very, very proud about. So the approach has 3 steps to it. The first, as you would expect, is about the nurses and midwives gaining that knowledge and accessing learning. And this is accessed via the e-learning for healthcare hub. Step 2 is that the knowledge that they've gained is assessed. And again, that's accessed on the e-learning for healthcare hub by 7 e-assessments. And once those are passed, the learner can move on to supervised practice, and they do this using a practice learning and assessment tool, and this is step 3. And when they've achieved their proficiencies, they've achieved their passport, so their IV therapy passport. And this is the ticket that means that they can transfer between organisations when they're ready to. So whether you're an adult nurse, a children's nurse, a midwife, or any other healthcare professional who might need to administer IV medication as part of their role, whichever healthcare setting you work in the community, in hospital, it's one passport, it's the same passport. And it's this that enables our nurses and midwives to transfer. So many of you will have seen the work, but for those that haven't, I'm just going to share a little bit of it now. Next slide, please. So step 1 and 2, I've mentioned already, this is about learning, so accessing curriculum and assessing knowledge. If we play, please. Thank you. So this is just a little tiny snapshot of e-learning for health. We're going to enter an e-learning session, and below that you could see the e-assessments. There are 7 e-learning sessions. We're just going to enter one of them. The 7 sounds a lot, but actually when you look at the complexity of giving IV therapy drugs, this is what the stakeholders felt we needed to cover the full curriculum and be thorough. So within each session, they're sectioned, and we've gone into one section, which is an overview. Every session has learning objectives, so learners know what they should be able to achieve through that e-learning session. And hopefully what you're able to see is that it's very visual, it's a clear format, it's also interactive. We're going to scroll through a tiny bit of content just below as it expands out, so there's not too much on the screen. And after each section of a session is completed, then there's a knowledge check, and this is just to confirm understanding and make sure the learner understands before they proceed. So one of those 7 sessions is drug calculation, so that's always really topical within IV therapy. So we have a drug calculation session and an e-assessment, and that meets the needs of nurses, adult and child health nurses and midwives. So that's one of our really great successes, that we've able to make this fit for all. And it is a digital route, but it's also blended, because we're obviously blending in with practice learning and assessment, so that the development of skills. Next slide, please. It's playing again. So next slide, please. Thank you. So step 3, as we learned, is about moving into supervised clinical practice. So this is a stage where learners are able to apply that learning into practice and rehearse and practice, and then prepare for assessment. So within the documents, so you'll see on the left-hand side of your screen the practice learning and assessment documents. So we abbreviate this commonly now to IV PLAD. On the right-hand side, you're seeing a screenshot of what's to come very soon, and that is a digital passport. So I'll tell you a little bit more about that in a moment. So for practice learning and assessment, we have core proficiencies, but also a selection of optional proficiencies. And this means that learners can select proficiencies that are relevant for their scope of role. And this has been really important. So through our consultations, we identified the varying scope of practice and the need for learners to be able to select what's relevant to their role. So we do that through those. So for example, you can select the vascular access devices that are relevant to your practice. All of those proficiencies are summarised in the record of achievement, and we can see an image of that on the right. So this is the quick summary of the proficiencies that you've been deemed a proficient in, and those are the skills that you're going to be transferring. And when we do transfer, we have something called a transfer conversation, where we look at that record of achievement and we think about the skills that we might need in our next role, and where we might need to access further proficiencies to meet a different scope. So that the ability to be flexible and to have a passport that can develop with a learner has been really, really one of the key components of this work, because practice doesn't stay still, practice does develop over time. Next slide, please. So the title of this slide is Collaboration, and this is a really, a happy moment really to share the extent of the collaboration that we've had. In order to really understand the landscape that we were looking at and understand the problems people faced and what they wanted for the future, we really needed large consultation, lots of engagement to try and get a really good handle on that. And it has been, I would say, really crucial to the success of the project. And that's why I really believe that this achievement is a London-wide achievement, because of the extent of that collaboration. So we had great engagement right from the start, and many of those organisations are still engaged today, so still working with the project. So there's been over 30 NHS trusts in London engaged. We've been engaged with social care, primary care, the independent sector, the charitable sector, and also really important, our higher education providers across London. And this has been crucial because, as we all know, we were 2 years ago planning for the implementation of the future nurse standards, which obviously now have been implemented, and expect our registrants to register with IV proficiency. So many of the representatives from these organisations have been our really key stakeholders, and they have been instrumental in the design and build. They've been our authors, our editors, our reviewers of content. They've provided that guidance as subject matter experts. And we also have had some partners that we've worked with. So really importantly, Capital Midwife, but also, as I've mentioned, e-learning for healthcare, Axia Digital, who are the provider for the digital passport, and I think are attending today, hopefully, and the Royal College of Nursing, as I've mentioned. So thank you once again for your engagement and your collaboration. Next slide, please. So we move on to look at implementation. We are reaching the end of that build phase, really. I was going to say development, but I think we have definitely reached the end of development, but we are coming to the end of build as we finalise our digital passport. And what we were going to do was go live with a digital passport. But as we all know, COVID happened and turned life as we knew it upside down. And Chris mentioned we went live in March in the end, much sooner than we expected to. And going live in March meant that we went live with a paper practice learning and assessment document. But it's been fantastic actually to see the implementation even during COVID. I think for some organisations it's been really helpful in terms of providing a digital route to training, so suddenly unable to deliver face-to-face training but still needing to train nurses to deliver IV medication, so to do that cross-skilling and to be able to deploy staff, but also to manage the new starters as they're coming in. So I think, having gone live has been beneficial, and despite having gone live in a rush, we still have a great picture of implementation across the capital. Next slide, please. Let's focus, that's coming into focus. So we see here the picture of our 5 ICSs across London, and all of those organisations that have implemented or are implementing across London. So you can see the NHS Trust there, but you can also see we have the independent sector planning their implementation, and we have several higher education providers planning their or implemented or planning their implementation. And I'm really sorry if you're here today and you're an organisation who have implemented and I don't have you listed. I really apologise for that. The information gathered is again from my engagement but also from survey data, but things are changing constantly and implementation is growing daily, so that's it's great to see. I heard very recently that we have a social care provider in the southeast who has implemented, and I know in north central London there's social care who are looking at implementing the work too, so that's superb. So we'll have some recent data from e-learning for health as well, which so takes us to the beginning of September, and we can see from that data that 7,000 e-assessments have been passed, so they have achieved the pass mark in London since we implemented, which is amazing. So when we think that the 7 e-assessments per passport, so that's probably approximately 1,000 passports. When we look at the national picture, there's a further 4,000 e-assessments that have been passed. So again, a really significant number looking across the country. And organisations definitely at different stages of implementation, but it's great to see it happening, and really excited to see that grow over the coming months. Next slide, please. So this slide really is about what's happening, what's going to happen next. And I think one of the most significant things we're going to see happen next is the transfer. So staff, nurses and midwives moving between organisations with their skills, which is obviously the crux of the work. And I think we will see that more and more as more organisations start to implement the work. And obviously another key thing that you'll see happen soon is the implementation of the digital passport, which we're hoping is going to be within the next couple of months. But now really it is over to you for implementation. It sounds daunting, but it isn't as daunting as it sounds. And we're going to hear now from 3 organisations who have implemented the passport, and to hear their stories and share their successes as well, really. So I'm going to hand over, I'm going to say one final thank you, and also to hand over now to Hafsoa, Begum from Bart's Health and Ropo from Bart's Health, who have been engaged right from the start, have been brilliant, brilliantly invested. So it's lovely now for them to be able to share their story. So next slide, please. Thank you. And over to Rope. Yeah.
Hafsoa, please unmute yourself.
Apologies. Thank you. Thank you, Susie. My name is Hafsa Begum. I am the Senior Nurse for Postgraduate Education at Bart's Health. Between myself and my colleague Ropo, we will be talking about exactly what Susie has said, putting into action this vision that we had for seeing the IV passport going electronic with this e-documentation. And it's been fantastic. We have seen people from all different sectors actually coming together and participating in this e-learning. And it is so reflective of what Susie has actually explained to you all about where we wanted this to go. We've had people from the community come in, do the e-learning, pick it up. And actually, it's come at a time when we were hungry for it. Not only were we hungry for it, but we needed it. And as you mentioned, Susie, COVID came, and what better time than to go live with it? We just went with it. And it's, honestly speaking, it's been fantastic. We haven't looked back, and we just want to keep going forward with it. We've mapped out our journey. So from where we started, where we were, to where we've been and where we're going. And I'm going to hand over to my colleague, Ropo, who's going to take us through that journey, through that implementation phase. Over to you, Ropo.
Thank you very much, Asta, for the brief introduction, and thank you to Susie as well. It's been nice working with you. My name is Ropo Olafe, one of the nurse educators based at Bart's Health, and I will be presenting mainly, but also a discussion on how we've implemented the CapitalNurse IV Passport and e-learning, and also how we've transitioned from there. Thank you very much for listening. Next slide, please. So this is where we used to be. As you could see, we had a full day program at Bart Health, which incorporated our morning session of theory and then an afternoon session of pump training, pump specifically for different, clinical specialties. And then we had an IV therapy workbook as well, which is a competency-based practice document. This is what the nurses would take to their clinical practice with the support of their supervisors and staff facilitators or PDN. So they will complete this, and after completion, they're IV ready and ready to kickstart. So this is where we used to be. Next slide, please. And how did the journey begin? There was a background, but also there was an alignment. And in the background, in 2008, we as educators identified that clinical practice managers and were finding it difficult, challenging to release staff to attend training. So this impacted on DNEs, and also there were last-minute cancellations, where nurses are needed in clinical practice and they are drafted back, so they wouldn't be able to come to the session. So we went into a meeting with stakeholders, which included the practice managers, we also ward managers, and also matrons and senior nurses and in clinical practice. And then from that meeting, there was the interest in having a shorter study day to IV therapy, and I think also mainly, converting it to e-learning. So already we've had precedents because we've transformed the cannulation and venipuncture to e-learning already. So, and this has gained much interest, especially in clinical practice, because now we have just practical sessions, which is like 2 hours, and they are back into clinical practice. So we had that precedent in terms of, putting e-learning together. So myself and my colleagues started to look at how we would, transform this. And then on the other side, where the alignment was our director meeting Susie in the meeting, also who was the CapitalNurse IV lead, and they got talking, and there was, we learned that she was also leading on, some form of transforming the working with CapitalNurse to do some e-learning, and also which would be something that will work across Pan-London. So we became interested in that. So we started to join the stakeholder meetings, and attended it. We also had time to have meaning about what, she was doing. We worked in collaboration with CapitalNurse and the team, and also the colleagues at every level in the redesigning, and also the transforming of the PLAD, and also the IV e-learning, therapy e-learning itself. So when it came to the pilot, we also wanted to take part in the pilot with such a very, very big trust, and the nursing workforce is quite extensive and large. And we felt that if we did the pilot, it will help the staff to have a meaning of the documents and the e-learning, but also familiarize with it. We could also have their experiences of it, from those who have done it. We could have experiences from the facilitators and supervisors, and also experience from the PDNs. And this will be crucial to the fact that we also take it forward from there. So it was quite, crucial we had that. Next slide, please. So this is our journey in terms of the pilot. So we had the phase 1, which was the pilot in the PLAD, and that was in 2019. As we can see from these statistics, 12 nurses signed up for this. It was voluntary because we didn't want it to be mandatory. We wanted to get their experience, but wanted also for them to be committed. And these 12 nurses were adult nurses from various clinical areas. So we were able to feed back to Susie their comments from the supervisors as well regarding the PLAD, which also made a very, very difference. Because for me, as the lead, it was about how this fits in with clinical practice, and also how it meets their learning needs in terms of, what they needed to develop. Again, we also had the second pilot in February 2020. So again, as you can see in the statistics, we had ped nurses. So it wasn't just adult nurses at this stage. There were ped nurses as well, pediatric nurses who had also joined. We were also accessed the e-learning. So we had 41 nurses in total who accessed the e-learning and completed it. And again, we could also see that there were various clinical specialties, who did this. But again, that also gives us the idea that this e-learning also meets also the needs of various clinical, specialties, and not only adult alone, pediatrics also mainly. Next slide, please. Thank you. Then came the COVID. So the COVID came, again, it was, just changed everything in terms of clinical practice. It came in a rush and, had a very hard hoc, and we had to think about how we could ensure that we respond to clinical practice environment in terms of the safety of the patient. Also, we needed to also make sure that we supported the nurses also in terms of their own safety. Now, as you can see then, when the COVID came, there were government directives as well. There was reduction in clustering, social distancing guidelines. Again, staff were very anxious to come to face-to-face training because of COVID infection. We also had the Hillenden hospital experience, which was also published. But again, on the other hand, we also had the clinical, ward needing nurses. We also had to mobilize practitioners or CNS working in different clinical areas to the wards to make sure that, patients are supported. This also they needed also to have their updates, and they needed to have an upskilling or refresher, just to make sure that they are confident in giving IV therapy. Actually, researchers suggested that 80% of clinical interventions are done, with IV. So it's quite very crucial that we responded to this. Now, we had experience of VNC already, experience that we've also transformed venipuncture and cannulation to e-learning, so we were comfortable with that. The fact that we were confident also that we had also actually taken part in the pilot. So these documents have actually been used in clinical practice by the pilot nurse. And then again, some nurses have accessed e-learning again on the pilot. So I actually had done the e-learning myself just to make a meaning of it. So I did, we just decided, well, we don't have any option. That's the best option we have. And the fact that a Bart in hand is worth 2 at this moment. So there was nothing we could do at all than, just to, with little information, direct nurses to do the e-learning and the e-learning at this stage. That's what we had to decide. Next slide, please. So although this is not a true reflection of the number of nurses who've accessed the e-learning, but this is the nurses that responded to us when we were collating the statistics for this, presentation. So we would have higher numbers than this, but these were the nurses that responded to say that they have accessed e-learning. So what is crucial here is the fact that it met a lot of the specialties needs. So we have midwives this time. We had pediatric nurses, we had allied professionals, we had practice nurses who had to work in clinical areas, but they had to do the e-learning to upskill, for the IV. At this time also, we had the NMC also who had a temporary register. We just had IN nurses, international educated nurses come from, abroad. And they also needed to join the NMC register ad hoc during the COVID period. And we needed something also for them to develop IV skills because they would be working at band 5 level during this period. So, and we had community nurses also who had pediatric experience, who also wanted to work in the clinical practice during the COVID period. So we would say it actually met the needs of a lot of the nurses during that period. So we did have a variety of nurses from a variety of specialist areas who had actually, or specialty had actually accessed the IV learning. Next slide, please. So, well, there's no way we wouldn't have had challenges. We had challenges. Like I said, COVID was very, very uncertain. It came in ad hoc. So because of this, we didn't have time to communicate or organize or actually even launch the program at all. So there was very limited information for nurses about the program. I remember we just had to put just a little bit of information on our intranet just to redirect them. Again, this also had to stop the medical device training because they couldn't do a face-to-face, but they put a video on, and about 5,800 people had viewed the video on the pumps. We didn't have a sustainability plan at all. There was no context to what we were doing. And again, we were quite concerned that nurses might, develop, may not develop skills or may also have learning gaps because there was no support mechanism for this. So our next step, just based on all our challenges would be, and we're working on this closely with Susie at the moment, to ensure that we have a link from our trust to the CapitalNurse e-learning platform so that we could have a record, not only that for easier learning of our nurses and our workforce, but also for us to be able to capture the record and monitor those who are accessing it, because at the moment we didn't have any record of those accessing that. But also being able to launch the IVT program as well, launch the new program, and this will also create an awareness for the workforce, so they will know about it. They will know also where to and how to access it. So all this will be part of how we launch it. We've not been able to update our relevant policies, bring them up to date about the new program, because also we need to make sure that this also information is there. Just to ensure that nurses are safe in clinical practice. Again, information guidelines to staff nurse, we need to make sure that that also is in place. Again, we need to make sure that we have a mechanism that will support staff, especially in achieving their competencies in clinical placement. So this is quite crucial. Also working collaboratively with the medical device team. At the moment, we're a bit disjointed from them. And just to make sure that the staff who are accessing the IV, therapy and completing their practice-based document are also, having their, training in the pump that is related to the IVs that they'll be doing in clinical practice. And lastly, to make sure that we have a mechanism to evaluate also and report on this new training program, just to ensure that it meets the needs of our nurses and also is fit for purpose. Thank you very much. Next slide, please. Thank you. So I would at this stage be introducing Sam Elliott Oleknovich. I'm sorry if I didn't pronounce it right. Okay, so Sam is a pre and post registration nurse based at Royal Free London, and Sam will be presenting and also discussing on how he's implemented CapitalNurse IV therapy with registrants and pre-registrants at Royal Free. Thank you very much.
Thanks, Roper. Thanks, Hafsa. Thank you for sharing your information. It's been really, really interesting to see what you've done. So like Roper said, my name is Sam Elliott Oleknovich, so you did say it right. I am a pre and post registration education nurse here at the Royal Free London NHS Foundation Trust. Next slide, please. So just a little bit of a background as to what we were doing. So obviously, I'm sure you know, during the COVID-19 pandemic, along with other trusts across the UK, our trust here, we took on a total of 74 aspirant nurses. And now these were the final placement student nurses that chose to opt in during the pandemic. In order to support them in practice, our education team designed something called the pre-preceptorship programme. This incorporated all of the elements of the CapitalNurse Preceptorship digital framework. And obviously included in that, we wanted to include the IV Therapy Passport as part of that. The reason we wanted to do this is twofold. One, we wanted to give the students that opted in, we wanted to give them something back, and we wanted to enable them to be prepared for when they do receive their PIN. And also we saw it as an opportunity with the passport especially, that they would be automatically ready to be assessed in practice once they do receive their PIN. So there wasn't such a time gap from when they qualify to when they actually are able to administer and start practicing IV therapy. Next slide, please. In terms of our qualified staff and our new starters, the IV Therapy Passport has actually replaced what we used to do, which was face-to-face teaching for our qualified staff, and it has also been added to our Trust IV drug administration guidelines and policy within our trust. So it is now the official standard that we use for our staff that are working within our trusts. We wanted to do this because we thought that it provides clearer transparency, not just between the education team within our trust, but obviously pan-London, as was what was intended for the IV Therapy Passport. Next slide, please. So you can see here, this is the pathway that we have for qualified staff. I won't go too much into detail of this, but I'll just give you an idea. What happens is, obviously, when registered nurses come to work with the Royal Free London, we will ask them for evidence of prior learning. This could be if they've done the passport online already, or it may be what people were doing prior to this. So it could be evidence of prior teaching or a competency that they would have had done. If they can show us and provide us this, they will follow the pathway that's relevant to their clinical area. So just for an example, if they're based on their ward area, they would need to show their ward manager or practice educator available on that unit their evidence, and then they would go through the specific site infusion device training. Epidural and cytotoxic drugs tend to be more area specific, and this training will be given locally. If they were unable to provide us with any evidence of previous training, they would go onto the same kind of pathway as any newly registered nurse or midwife. So what we have in the trust at the moment, we have a drug administration workbook, which encompasses all drug other than intravenous drugs. And then once they've completed that and it is marked, they can then move on to the IV pathway. And next slide, please. So in terms of the aspirant nurses, the final placement students, we used a system called Moodle, which is a learning management system that we use within our trust for all of our accredited courses. We use this because all of the information in the presentation was enabled to be given virtually, as well as having the face-to-face teaching that we were able to do during the pandemic. This helped us because we were able to we were aware that there was obviously time constraints, and there was obviously letting all of these aspirant nurses come to a face-to-face session. So we wanted to make it available to them virtually. So we included guidance about the IV Therapy Passport and how they could access the e-learning. Next slide, please. So in terms of giving them the information, we distributed this via Moodle. This is also the template that we pass on to all of our staff that start within our trust. It's a kind of adaptation of what CapitalNurse had distributed to us, and we just made it more Royal Free specific. So following the, like you can see, following the introduction of the passport posters, we added myself as an assessor and gave them my details so that they could add that on, so that we as a trust could see who had accessed the e-learning and also who had completed it. And that's the way that we're going forward at the moment. Next slide, please. So recording of completion. So Moodle, one of the great things about Moodle, it enables all of the teachers and leads on the programs to see who has accessed that information, but most importantly, how long they've spent on accessing that information. So we were able to see who had accessed what and when and how long that they spent on that. Obviously, what we also had to do was link Moodle with the reporter mechanism on e-learning for health. So if anyone is added as an assessor, they will be able to generate a report to see all of the staff that have completed the e-learning and what stage they're at within that. Once all of these sessions were completed, we developed for the pre-preceptorship programme that we developed, including the IV therapy e-learning and the e-assessments, we issued them with what we called a preceptorship passport. This now enables all staff that have a preceptorship passport to access an accelerated preceptorship programme within our trust. Our current standard programme is over 12 months. What the accelerated programme is doing is now getting that preceptorship programme done in 6 months, because all of the people would have done everything that we'd encompassed from Capital Nurse for our pre-preceptorship programme on our pre-preceptorship training to translate over to the preceptorship programme. Next slide, please. So, of course, there are always things that we can improve on and things that we would like to get better. One of the main things that we want to do at the moment is linking the e-learning to health modules onto our trust learning management system, which we use ESR here. We are in the process of doing that at the moment, a lot of little bits and pieces going together. One of the reasons we want to do this is because at the moment, as I've mentioned previously, I am the only one in our trust that can actually see who has completed this, because they're only adding me as an assessor. Whereas when we are able to transfer this onto our learning management system, it will be more transparent and across the board. So it won't just be me, it will be anyone, any ward manager can see if their staff has completed this, accessed it, and where they're at in that process. Until that happens, the monthly reports are being downloaded and I'm saving them so we have a trust record of who has completed this. And that will be done both from e-learning for health and the ESR once that's all transferred over, so we can correlate them and just make sure that they match. And one of the main things that we want, and we've taken from this, is that we want to plan to run our pre-preceptorship programme for all final placement student nurses. We feel that, and we know that it will improve retention and staffing levels. And just as a kind of idea of numbers, out of the 74 aspirant nurses, the final placement students that we take on, we have managed to retain 55 of those. And a large part of that was down to the pre-preceptorship programme, which included the IV drug administration passport. So that was a great piece of work to do. Couple of pointers and handy hints that we feel that are really beneficial to anyone that wants to start using this and anyone that is using this. One is the fact that we think that anyone that is going to be an assessor should actually access it and actually do the programme themselves, however much experience you have in IV drug administration. We feel that this gave all of our team, which have done this, a really key idea of A, what the programme included, but B, how to troubleshoot when going through certain things. So if we had learners that had questions, we were able to answer them quite effectively. And also, last second point would be to access this onto your learning management system locally, so that obviously that you wouldn't be having just one person, like I say, with me at the moment, being able to access that information. But it is doable and it is transferable. We've been in contact with e-learning for health to do that. So yeah, thank you very much. Next slide, please. So that's all from me. Thank you very much for listening. I'm now going to introduce Laura Gilmore, who's from King's College London, and she's going to go through and discuss with you the integration of the IV Therapy Passport within undergraduate education at King's College London. Thank you very much.
Good afternoon, everyone. My name's Laura Gilmore. I'm a Senior Teaching Fellow in the Department of Child and Family Health at King's College London, and I'd like to introduce you to how and why we've integrated the Capital Nurse IV Passport pathway into our undergraduate BSc Children's Nursing curriculum. Next slide, please. When planning our next curriculum, which began with our 2019 cohort, we commenced an educational enhancement initiative. This initiative sought to support the education of student children's nurses in IV administration. The project scope included finding a way to easily identify a student's level of competency whilst they were in practice learning areas. In addition to this, the input of both students and trust partners was requested on specific theory and skills content that should be included, and also where in the curriculum that should be placed. Next slide, please. We held 2 collaborative workshops, both of which were attended by trust partners and student project members. The first of these focused on the new standards and what the project group considered to be the necessary education in each part of the programme in relation to IV therapies. I should note that at the time of the first workshop, we were aware of the CapitalNurse project and were initially planning to align our teaching delivery, where possible, to the content within the Passport pathway. Next slide, please. In our first workshop, which was recorded by a graphic artist, we started by looking at barriers, and several things really jumped out from the discussion. The first being the feeling of restarting every time you go somewhere new. With students potentially achieving competency over more than one placement and not necessarily choosing to work at their host trust after registration, this is something we wanted to try and avoid. The second barrier was the idea that nurses across different trusts may perhaps do things differently, and so we wanted to present standardisation in what was taught. The final barrier that was really key to how we could move forward was how to document what theory the students had covered and also how to get them to document their competencies as they were achieved. This was where the CapitalNurse project came in, as it was immediately identifiable that these barriers could be overcome by adopting the IV Therapy Passport pathway. For us, what was going to be a time and resource intensive task of creating a learning package became an opportunity to build on a foundation from a highly respected collaborative organisation. Having the availability of an externally accredited, collaboratively created learning package, which addressed the barriers that we knew we would find challenging, enabled us to focus on developing a comprehensive set of skill sessions and simulations to complement the IV Therapy Passport. The combination of the IV Therapy Passport and classroom practice and simulation provides the students with a strong foundation for moving their knowledge and skill development into their practice learning areas. Next slide, please. Over the course of our initiative, we focused on where this learning might sit. As we were designing a traffic light system, our first year students are in our red category. For the project team, we felt this was about laying the groundwork, for example, introducing the students to drug charts, calculations, and the BNFC. And this is all covered within our first year skills module. Next slide, please. As our students progress through the complexity within the programme, in their second year, or amber category, this is where they complete their IV passport. This is supported by 75 hours of simulated practice. This simulated practice gives the students protected time to complete the e-learning and e-assessments within the passport, and also involves their classroom skills and simulations. One thing that was key for us was that anyone giving an IV medication should be able to manage an anaphylaxis in their patient. And so to advance to the green category, our students must have a classroom teaching session on and manage a simulated anaphylaxis scenario. In order to attend their simulation and skill sessions, the students have to provide evidence of having completed the e-learning and e-assessments within the passport. And this completion data is then stored on a spreadsheet along with attendance data for the skills and simulation. This spreadsheet is then shared with key academic staff so that data is easily retrievable if requested by our partner trusts. Next slide, please. In our green category, the students are building on everything that they have learnt in both the e-learning and classroom sessions, and dependent on their trust scope of practice for student nurses, will be in a position to practice and be signed off in placement. Next slide, please. As our original scope was to develop a way of identifying how students are progressing through the development of competency, display materials are made available for trusts, and students are issued with pin badges of the appropriate colour for their level. These display materials clearly denote what has been covered and at what point they complete their IV Therapy Passport. For those students on our established curriculum who do not fit with the scope of the TLS project, we have introduced the IV Passport pathway into their final child-focused module of the programme. This learning will take place before their final placements, giving them the opportunity to develop that competency throughout their final 12 weeks in practice learning. To conclude, adopting the CapitalNurse IV Therapy Passport pathway has been a wonderful way of enabling us to meet the barriers that were highlighted from our trust partners and students. The use of a tool from a well-respected organisation known for its collaborative work has enabled the integration of a comprehensive package into our curriculum, which will be of great benefit to both our students and partner trusts. Next slide, please. And really that's it from me in a nutshell, so thank you very much. I would like to now introduce you to Jacqueline Robinson-Rouse, the Clinical Lead for CapitalNurse.
Jacqueline, please unmute your microphone.
Thank you. Apologies. There always has to be one. I just wanted to thank you, Laura, for handing over to me, and thank you so much for all four of you sharing your amazing implementation stories and the impact of what you've done. It's incredible. Ropo, and Hafsa, it was great hearing about since COVID hit us, your huge achievement in training over 151 people in the IV passport in a range of roles. That's so impressive. And for Sam, showing about how he's what an inspiring and responsive initiative to support aspirant nurses, to taking and leading that forward to work and have a recognisable platform for sharing people's progress in their training is fantastic, and we look forward to hearing how you progress with that. And Laura, for your incredible visual tool about supporting learners and trust about how learners progress on their journey. That's been incredibly valuable. There's just a couple of other people to thank before I hand over for questions and answers. One is Michelle, our exec sponsor, who kindly agreed over a year ago to take on that role and that mantle, and she's been crucial in helping us achieve this and have been an amazing champion for such an impressive piece of work that's been undertaken and achieved. And of course, Susie, who's been an absolutely incredible project lead. She's a great collaborator, and she's shown great collaborative leadership and engagement with people right across the system, and listened and tried to adapt, but come to some pragmatic conclusion about how we could move forward. And, achieving, and co-creating a single standardised approach to IV therapy for London. And also to Susie, to Victoria, thank you for kindly coordinating this event. You've managed to keep all of us in check and lead it incredibly well. So thank you for that. And for Zuli, supporting in the background. And finally, without not least, say thank you all of you that have worked with us collaboratively on this project. We really couldn't have done it without you. And it's an inspiration to see, and I hope you feel you can look back and reflect and feel empowered about how you've achieved this collective leadership, and collective action once for London. So streamlining the process for nursing and making a difference for patients and staff. So well done. I'm going to now hand over to Michelle, who's going to moderate the questions and answers. So feel free to write them in the chat. Thank you.
Thank you, Jacqueline. So I think I've got the easiest job, but it's not quite feeling easy at the moment because I've got 15 questions, which I'd really like to try and get through. So I'm going to do this really whizzy and quick. So and I'll bring in each speaker to respond to a particular question. So please bear with me as I just bring up my questions here, which hopefully you can all see because they've been published. So the first one has been answered, which is around, is there a plan to roll this out nationally, which Chris answered. I think we'd promote it widely. I noticed we've got someone here from Plymouth today. I think it's Gary, which is the next question. So certainly it's getting further out. I think the best way is by local teams sharing it wherever they go and having events like this. So that's the first one. The second is going to was around can we access the learning even if we're not part of Capital Network, CapitalNurse? Jacqueline, you've answered that. I don't know if there's anything else. You put through CapitalNurse web page, which leads to e-learning for health. Is it really clear? Do we need to send out some more comms, Jacqueline, just around that?
I think it is fairly clear, but I think we will send out further comms if queries come in about that. But yeah, it's a fairly straightforward process, which if you go onto the website, it's step by step. But absolutely email us at capitalnurse@he.nhs.uk if you have any questions or any challenges around that.
Brilliant, thank you. Tess, you asked about whether other organisations, so from the private sector or social care providers, whether they can share their experience of implementing this. I think I'm going to ask the team to take this away, so Susie and Jacqueline, just about how we can continue to share the examples of good practice that people are very keen to share about their experience, following on from Ropo and Sam's discussion of how they've implemented it in their trusts. So I think it's more how we learn as we go forward. So thank you very much for raising that, Tess. The next one is around is there a chance now that we roll this out for other clinical skills and have a clinical skills passport? I think probably Susie and Jacqueline are the best people to answer that, and it may be one that you just want to take away, but maybe Susie, just your initial thoughts on, could this be applicable to other clinical skills?
I think, am I being heard? Yeah, I think I am. Yeah, I think when we started, that certainly was part of our consultation. Well, what we heard in our consultation, that there was a huge appetite for other skills. I mean, the one that springs to mind straight away is venipuncture and cannulation. But we, this was one of the first kind of passports that we have embarked on, and we needed to start somewhere. And I think we needed to check if it was possible, find out if it was possible. So it would be great to think that this was just the starting point. But I think, yeah, we'd need a system in order to do that going forward. But yes, there are other skills that could be passported. Not all need to be, but some definitely could be.
Brilliant, thank you. I don't know, Jacqueline, did you want to add anything, or you?
No, I think Susie said it all, but yes, we're always open in Capital Nurse to looking at things, standardising things that will support people in practice. So yeah, absolutely, we'll listen to the system and see what they'd like us to prioritise next.
Fantastic, thank you. The next one is from Rachel, is around the new NMC proficiencies, so the standards, and newly qualified nurses and midwives coming out with their IV proficiencies. Will they just go on to do the assessments, or as they wouldn't need to repeat training? I wonder, Laura, could I just bring you in there? Just wonder what your experience is with the new third-year graduates that are coming out now, whether you've used it with them, and what's your experience?
We were hoping to use it with our third years, but unfortunately COVID kind of got in the way of that a little bit, which meant we were limited in what we could do. But certainly our current second years will be undertaking the pathway this year, ready for going into their third year, and our current third years are going to be going or completing the passport in kind of February, March, ready to go out into their final 12 weeks of practice. We would hope that within that 12 weeks of practice they get plenty of opportunity to develop those skills and are ready for sign off of competency within that.
Brilliant, thank you. And then maybe Sam, whether you'd like to just come in to what's your sort of reflection of what it would look like at the Royal Free London for third year students coming as graduates?
So obviously we're working quite closely with our higher education institutions that we work with already, and as I mentioned, like we added this as part of our pre-preceptorship programme, and actually when it came to actually the learners actually going to do this, a lot of them came up to me and said, we've kind of done this already because we've been kind of guided towards that area anyway. So I think one of the main things is obviously keeping all of our practice educators that are ward based and on the areas as up to date as possible as we can in terms of the standards and what is changing. We do have monthly forums here where we update all of the educators so they know what to expect and what is coming. And obviously with the passport, they know that obviously it is transferable, and they also know that IV drug administration is being brought in within the new standards, so they are aware of what's coming. So the idea would be is that they would come into their position with their e-assessments and their e-learning done, and then they would go into the supervised practice and those elements of it.
That's brilliant. Thank you, Sam. Thank you. I've got a question from Georgina Barking, Havering and Redbridge University Trust for just whether we'd have access to this webinar. They're starting to use it with maternity midwifery, which is fantastic to hear. Yes, the recording will be available. I'm not quite sure how, so I'm hoping either Jacqueline or Victoria can just respond and maybe just say how it will be available. I don't know, Victoria, do you know how we can make it available, or we'll just take it offline?
We will make the recording available to the audience. An email will go out to everybody and I'll let them know how this will be actioned.
Brilliant, thank you very much. There's an excellent question which I think Susie's already answered, so I won't go into detail. There's a specific question about one of the pages, which is the transfer conversation record and how it is used. I think that's been answered pretty well. So Eva, I hope that answers your question well, and everyone else, it's really useful to see this. It's about how we just make sure that nurses aren't asked when they move organisations to complete a new IV passport, how we can use this specifically. So that's a really good question there. I think I'm quite keen for an answer for this one, but I'm sort of pitching, I hope the right way. I think Susie's probably best placed. Is what is the elements that healthcare support workers are learning regarding IV passport e-learning?
Thank you, Michelle. I'm just reading that question at the same time. What is the element that healthcare support workers are learning regarding IV passport? So healthcare support workers in terms of our unregistered workforce, I think you're meaning. Well, at the moment, the IV therapy passport is kind of available for registrants, people who have professional registration, and have that kind of have that accountability within their role. So although a healthcare support worker could access the e-learning and the e-assessment, unless this is something that's happening within your organisation for them to be administering IV medication, I'm not sure the entire pathway would be relevant, but again, that might be organisation dependent. I think I've answered that. I don't know also whether it's asking about the breadth of the curriculum within the e-learning, but it is, I mean, in a nutshell, broad and rigorous. So yeah, I hope that does answer your question, Helen. If it doesn't, you can quickly type and clarify again.
Brilliant, thank you, Susie. I'm just, I think, yes, student midwives who have opted in, I presume you mean, Pretty, that they've opted in terms of they've been working in practice, they're absolutely included. This passport is absolutely inclusive of all nurses, including experienced nurses, actually, who, you know, I think there's a value of them reviewing and refreshing their practice. So absolutely, it's appropriate.
Sorry, Michelle, could I just interject? Yeah, it's for nurses, midwives and anyone, a registrant, any healthcare professional like an AHP that may want to give IVs as part of their role.
Brilliant, thank you. There's a few things that are being answered as we speak, so I won't go into those questions just to keep the time. There's a question from Rachel, can staff self-verify their competency if they've done the e-assessments? They're looking at doing it for clinical skills and wondered if we'd considered this. So self-assessment of competency. I wonder if, Susie, I could bring you in.
Yep. Am I in? Thank you, Michelle. So can staff self-verify their competence if they've done it? So this is established workforce who are already giving intravenous medication, I think you're meaning. We haven't implemented a self-assessment process. We have consulted on this widely. We've discussed it as a steering group. And actually, it's not something we have implemented. The best thing to do is for any assessor or supervisor within within the pathway. It's useful that they do the e-learning. It wouldn't take them too long because it is existing knowledge and the e-assessments. But in terms of practice assessment, we wouldn't want them self-assessing really, because we would, if they want to gain their passport, expect that some assessment process occurs. And if you have existing knowledge and skills, it would not take you very long at all to do that. And I think that's really, really critical for quality, for validity, for I mean, part of managing a change across a system is about people buying into assurance of quality. And I think for that reason, that's one of the reasons why we haven't implemented a self-assessment process. We need that kind of assurance, really. I hope that answers the question.
Brilliant, thank you, Susie. I'm going to bring Sam in for the next question, but before I do that, just a lovely comment from Joseph at Bupa Cromwell Hospital. I'm going to read it out because I think it's really important, bearing in mind of the COVID-19 pandemic. Thank you everyone for a great achievement. Glad we at Bupa Cromwell managed to help out during testing phase. We have started implementation. Fantastic news. Thank you very much. That's really good to read. And then Sam, I wonder if I could bring you in to answer Amy's from London Northwest around reasonable adjustments for dyslexia, people with dyslexia, for example.
Yeah, not a problem. So this was actually one of my key kind of concerns when joining the group, because being dyslexic myself, I found it like I wanted to make sure that whatever we were doing when we were doing in the steering group, that it would be accessible and it would be appropriate for people with dyslexia. So one of the things that I've been doing here is that if they would like to, because obviously not everyone wants to disclose the fact that they are dyslexic, but if they do and they would like support, I'm more than happy to arrange one-to-ones with them to go through the process with them, and obviously be with them when they're doing some of the online e-learning. Not that I would be giving them the answers, but just to support and help them go through that. One of the major things that I was impressed with was how visual the e-learning was. So it wasn't just about the words that came out, it was about the images that were on there as well, to enable the learners to not just obviously see the words that were on the screen, but the visual impact of that. But in terms of an implementation point of view, we have put out there that if you are having problems, if you are dyslexic, then there is support and we are more than happy to help you with that.
Brilliant. Thank you, Sam. Just a practical question. Apologies, got some feedback now. What is the plan to keep the slides and material updated, i.e. new guidance standards? And we have talked about this in the steering group. Susie, I wonder if you can just update on going forward.
Yes, I'm happy to. Could I just pick up on the question around dyslexia as well? So e-learning for health has quite a lot of accessibility features within it, and you're able to click an eye icon within the e-learning and e-assessments, and it will give you some options around the visual needs around dyslexia, which will change background colours, filters, that type of thing. So that's been, yeah, quite a critical part of our consultation. But thank you, Sam, for your wisdom there as well. So the plans for keeping slides and material updated. So yes, this is obviously critical. Practice does change, standards will change. We've worked really closely with the RCN around the IV therapy standards, and they are due a new edition very soon. Part of what we have constantly talked about within the steering group is about future governance and assurance, and this is still something that we're working on, but we have such a big stakeholder group and people who are still working with the project. So one of our visions is to keep these people working together so that we can have future governance and assurance, and in that way we'll have a review period for content. I hope that answers the question.
Brilliant, thank you. I'm going to just wonder whether Ropo from Bart's Health would be able to come in for the next one, which is around who can be a organisation's approved educational supervisor. And I just wondered, in your example of implementing across Bart's Health, who you've used for that role.
Yeah, thank you very much, Michelle, for that, and and thanks for asking that question. At Bart Health, we do have a supportive mechanism. We have an in-house training for those who would like to assess in clinical practice. So it's called an assessor and supervisor training, which is like a module. We have that. We do also have clinical nurses who would have done mentorship. We do have that sort of database also that has the name of mentorship in clinical practice. So we have PDNs also to some of the clinical area specialties. So they would also know those who are very experienced and can assess and support nurses to develop competency-based, practice in clinical environment. So we do have like a system or mechanism, to that, where when they've completed their practice-based competency, we would ask them who their supervisor is or their facilitator. Then also, as part of the education team, we do have educators who are site-based. Don't forget we are spread over 5 sites within Bart Health, because it's quite a large hospital. So we do have our colleagues also who are site-based and also to go to clinical areas to support of nurses who do need support to complete that. Yes, we do have that support. So I'm not sure if that has answered the question.
That's brilliant. Thank you very much. It's always good to answer a question with an example, isn't it, of where it's been implemented. It's always really helpful. So just, is that Susie? No, sorry, some feedback there. I'm going to keep going. Just a lovely comment from Hilary about to say implementation at Sheffield Children's. So this is definitely going wider than London, which is fantastic news. So thank you very much for that. I wondered, Jacqueline or Susie, do you want to just answer a quick question? We've only got about a minute. Any plans for the passport for use in neonates?
I can answer that question. Yes, it can be used in neonates right now. So neonatal, they have been consulted and engaged in the work. So yes, it can be used in neonates. We are, yeah, there we go.
That's fine. Thank you very much. Thank you. We've just got the last one, which is students can access the learning material and Ivy pathway through their university. So absolutely, they can access it. And then finally, the final question, we won't take any more. If there's anyone putting more questions in the Q&A, then I will make sure the team get them so that they can respond outside of the event, but we'll have to finish on time. Final question is for, I think, Susie, please. Is there an update part of the passport for nurses to complete at a specified time, raised by Anna?
Thank you, Anna. No, not at a specified time. And we took the decision as a steering group after a lot of consultation with our stakeholders that actually we wouldn't implement a regular update period. So it's just as part of ongoing professional development. So where somebody identified that they needed to update, or that was identified as part of performance management, then that would happen then. And anybody at any point can dip back into the e-learning or e-assessment.
Brilliant. I think we got there. There are no more published questions. Well done, team. So thank you so much. I just thought I would just end with a couple of points. Whenever I attend a conference, and especially in this new world where it's virtual, I always like to think, well, what's the learning for me? And has this been of value this morning? It certainly has been of value for me. I've learned masses. I've made some really nice friends, which is lovely through this. I suppose there are people who can help you implement. We've heard from some great speakers this morning from both Royal Free, King's College, as well as Bart's Health. where we've learned about how it's been implemented. I know all of the speakers are very happy to be contacted outside of this meeting, so please do get in touch, and you can get in touch through the Capital Nurse email address, which was given at the beginning of the event in the chat box. I wonder if Victoria could put that up again, or Jacqueline, so that people can take it again. I think we're very keen to see this implemented across health and care, as well as the public sector, as well as the voluntary and private sectors. So I think that's a really key message for us. I think this way of working is really effective, and I think the chances for us to extend this to other clinical skills is something we should really promote through Capital Nurse. And if anyone has any ideas of where we should go next, which skills would be the next most appropriate ones, I know the team would love to hear. So certainly maybe Jacqueline would be the best person to direct your thoughts. And then my final one is just, we have given you some really practical examples, and I suppose I'll use this opportunity just to thank our speakers this morning. And obviously if we're all sitting in a room now, we'd give them an applause. But of course, it feels a bit different doing it like this, even though we've had over 100 people join the conference this morning in the event. And I think my final one is just, this is our opportunity for third-year students to become ready for practice when they qualify. I think it still remains a really scary time for new graduates. So this doesn't mean they need less support. It will mean they need just as much, if not more. But they will be much more work ready, and that's only to be promoted. And seeing Laura's presentation, it's fantastic to see how the universities have really sort of embraced the Capital Nurse IV Passport. So we have 2 minutes left. I think we should give you 2 minutes back so you can go to the loo before your next meeting or your next event, because I'm sure if you're anything like me, you go from one meeting to another. But just a final really huge thank you, probably mainly to Susie, who has pulled this all together during a pandemic, which none of us ever will have experienced before. And she's kept going, smiling, and resilient, and I think we should really thank her for that. And we have a fantastic IV passport to use across London and beyond. So thank you very much to all our speakers. Thank you for all joining us and your great questions in the Q&A. Thank Victoria, Zuli, thank you very much for helping us with the administration of this event. So thank you very much, and I think you did it. So well done, everyone. Goodbye, and thank you. And that's the end.